We're here in beautiful Sydney, Australia, to learn about Nanosonics, a global leader in innovative infection prevention solutions.
What probe compatibility is safety for patients, safety for users, safety for equipment.
That represents about 100,000 patients every day being protected against the risk of cross-contamination.
All the months worth of work that you're doing to make sure that my probes are compatible with your machine. It just makes me feel like I can be confident.
We're here in front of the iconic Opera House in beautiful Sydney, Australia, to learn about Nanosonics, a global leader in innovative infection prevention solutions. Founded on the principles of innovation and dedication to patient safety, Nanosonics has emerged as a global leader in automated high-level disinfection technology for ultrasound probes. From their cutting-edge Trophon 2 device to their advancements in ultrasound probe compatibility, Nanosonics continues to raise the standard in infection prevention. Join us as we take you behind the curtain, exploring the minds behind the technology and the lengths they go to ensure safe use of ultrasound probes on this episode of Beyond the Tour. Before I left for Sydney, I wanted to prepare by talking with a big player in the ultrasound probe space. So I connected with Reg Rumwell, resident expert at Siemens, to pick his brain before my trip. Reg, thanks so much for jumping on a call with me today. Me and my colleagues here at Beyond Clean are heading out to Australia, and I would love to hear from you from the manufacturer's perspective. Why is probe compatibility important? Why does it matter?
Sure, Linz. The reason we go to such great means in working with our partners to establish probe compatibility is primarily so that the equipment continues to function as the customer expects it to function. We provide very detailed instructions. Their instructions for use are on our website. And by following those, it really saves the customer a lot of angst in terms of having to rescan patients if they've damaged a transducer, having to get replacement equipment if they've damaged a transducer. The compatibility aspect is key. And it's important that, the customers realize the length that we go to ensure they're going to continually have a good experience with our equipment and really do the job that it needs to do.
What I'm hearing from you is that non-compatible reprocessing of your ultrasound probes and transducers can lead to ineffective equipment, images that are not clear. Is that correct?
That's absolutely spot on, Lindsay. And that costs both us and our customers an awful lot of capital as well. The reason we do all of this is such that, the hospitals can be sure that they're not having issues with HAIs, nosocomial infections. The previous topics we discussed about damage and cost of the equipment, about diagnostic accuracy of the images they're generating from our ultrasound probes. It's really super important that the customers really follow the instruction we give them and have the confidence that, we've done the homework. We've worked with our partners. We are confident when we recommend, here's how you clean or disinfect your equipment.
This has been a really great discussion. I'm excited that I was able to connect with you before going and meeting with the Nanosonics team in Sydney. Thank you so, so much for your time today. I really appreciate it.
You're absolutely welcome, Linz. Enjoy your journey and give my best to our partners down in Australia.
After 20 hours of travel and a few much-needed naps, Bobby and I arrived at the Nanosonics headquarters to meet up with our friend Sunshine Macro, Vice President of Marketing for the Americas, so she could introduce us to the team in Australia.
Lynn, Bobby, we are beyond excited to have you guys here. Ever since we first started talking about probe compatibility, probe damage, all of that, we've just been waiting for the day when we could welcome you here to our Sydney headquarters. We have the best of the best lined up for you today. We've got John, our Chief Medical and Scientific Officer. We've got Matt, our Strategic Partners Manager. They are gonna take you behind the scenes. But first, I gotta introduce you to our most important person, VIP, our CEO, Michael Kavanagh.
Well, thanks very much for the introduction, Sunshine, and welcome to Australia.
Thank you.
Nanosonics was formed probably just over 15 years ago with the sole purpose. We were looking at the need to transform medical device reprocessing to deliver improved patient safety and better healthcare outcomes. Our Trophon technology really pioneered the automation of ultrasound disinfection. Today, there's approximately 35,000 devices in use internationally. And that's one statistic about the number of devices, but really how we think about it as an organization is that 35,000 devices really represents about 100,000 patients every day being protected against the risk of cross-contamination because the ultrasound transducer that is used on that patient has been decontaminated in the Trophon device. So when you think of 100,000 patients every day, but that equates to over 30 million patients annually. So we're very, very proud of that fact. So over the course of our time together, I think you're going to get a great insight into the details involved in the probe compatibility program, not just what we do, but what all the manufacturers of the ultrasound products do as well. So welcome.
Thank you.
Thank you.
We're very excited, not only to be in Australia, which is awesome, but also to look at this kind of niche of medical devices that, at least in North America, feels like hasn't had a spotlight shined on it in a very long time. So really looking forward to it. Thanks for having us.
You're welcome.
From here, we headed out with John and Matt for a short walk from the Nanosonics headquarters to the production facilities to begin the tour.
So here we are outside of our lab and manufacturing facility. So just behind me is where we do the manufacturing of Trophon, and these are our labs where we do all the testing on the device. Trophon does high-level disinfection of ultrasound probes. So an ultrasound probe obviously is a reusable medical device in most cases. They're quite expensive, and so we have to make sure that the microorganisms from the first patient are not transmitted to the second patient. And that involves cleaning and high-level disinfecting the probe. The way that Trophon works is it actually uses hydrogen peroxide. It nebulizes this into a fine mist, and that fine mist coats the probe and disinfects it within the chamber. Okay, so let's go inside and look at some of the labs.
Awesome.
Let's go.
All right, so Linz, Bobby, I'm really excited to finally show you our compatibility labs. And what probe compatibility is really safety for patients, safety for users, safety for equipment. We'll start with bioscience lab, where we make sure that we kill all the pathogens. We'll go to the chemistry lab to make sure that the probes are safe to handle for our users, and then go to our material labs, where we look at safety for users and equipment.
Let's do it.
Good. Yep.
I wanted to introduce you to Kieran, who runs the Biosciences lab.
This lab is focused on the Trophon efficacy testing or any OEM testing. We do the production quality control as well. So new batch of Trophons being built. So we run the monthly quality control testing as well in this lab.
So you get to play with pathogens all day is what you're saying.
Yes.
So, okay, great. How does that process work? Are you using real pathogens in here, or is it substitute test soils? How do you do that?
That's also a good question. So what the process is, like you can see in the background, the real probes, they are actually contaminated, inoculated at multiple locations using a real pathogen.
Okay.
Probes are then reprocessed through the Trophon. And after the reprocessing, take the probes back and try to extract what is the residual bioburden. So we ensure that there is, as per the regulatory requirements, there needs to be achieving 6 log reduction in the bioburden on the total probe area to achieve that high-level disinfection. So it's not only one microorganism we're working on. During the development of the device, we tested a broad range of microorganisms, bacteria, fungi, viruses, spores, everything, so that we ensure that Trophon can be successfully, efficiently used to high-level disinfect the probes before and after patient use.
So you have to keep all those different pathogens in these refrigerators around the room. That sounds terrifying.
No storing your lunch in these ones. No food to be stored.
You mentioned outside that hydrogen peroxide is the method that we're getting that high-level disinfection. I'm curious why hydrogen peroxide as your disinfection modality?
Yeah, great question. So it's an oxidative chemistry. So it's really hard for microorganisms to evolve resistance to this because it has a very general mechanism of action, unlike some antibiotics. So you really don't see emergence of resistance to peroxide in a meaningful way for the pathogens that we deal with in clinical use. There's over 1,300 probes that are compatible with Trophon. They're all different shapes and sizes, and a lot of them have special features like indentations where biopsy guides are clamped onto the probe. So we take a lot of care actually in ensuring that every single probe is disinfected effectively with Trophon, high-level disinfected, by doing all of that specific testing on all of the individual probe models.
We're starting in this lab, and already the depth and thoroughness that you're describing is sort of setting the tone for this tour. I am so excited for what's to come.
After the biosciences lab, we went to the chemistry lab to meet Bahar, the research and product development team lead.
So Lynn, Bobby, I wanted to introduce you to Bahar. She's our expert in probe compatibility. She looks after our material and chemistry lab, and that's really essential in terms of probe compatibility for us. For chemistry, we need to make sure that any level of residuals on the probe is under the safety limit, so the probe's safe for the user and the patient.
Welcome to the lab. First of all, we run a standard cycle on a probe. We use minimal chemistry. It's a couple of grams only in each cycle, and then the device itself runs the exhaust process to take out all the mist from the system before the doors are open, and then exhaust product will go to a catalytic reaction to break down hydrogen peroxide to water and oxygen. And then we take the probe immediately inside DI water. We extract the residual left on the probes using the water bath, and then we take that extract to another of our labs to analyze and calculate the amount of residual.
So essentially it's like a rinse bath, and then you're testing the water to see if any of the chemistry showed up in the water.
So it's safe. We make sure that it's safe on every individual probe.
A critical step in the Nanosonics probe compatibility program is making sure the Trophon 2 does not damage ultrasound probes. So we went to the materials lab to see their process for ourselves.
This is where we test the probe for its life cycle, making sure that from day 0 to the end of the life of the probe, the technology is safe for it. Firstly, we measure its dimensions to make sure that it fits into the Trophon envelope, and then we do a fit test. We hang the probe inside the device, making sure that it fits properly. And the next step is to check the temperature of the probe surface during the cycle. What we do is to go with the worst case scenario. So we run 2 back-to-back cycles to make sure that if this is what happens in the fields, like very quick reprocessing, it doesn't exceed the limit.
Okay, so you're taking into consideration the fact that a probe can be reprocessed over and over and over again in a single day.
Yeah.
And you want to make sure it doesn't melt, essentially.
Yes.
You're not only testing the chamber temperature, which I'm sure the machine does, but you're actually putting temperature loggers and data loggers on the probe itself and measuring that.
Yeah, the important areas of the probe, which is the lens of the probe and also on the body of the probe.
Okay.
After that, we check if the probe is compatible with the technology during its lifetime, from day 0 to the number of years that a probe should be in the field. We run back-to-back cycles, 24 hours a day.
So are we talking 20 cycles? Are we talking 200?
We're talking about thousands of cycles, and it could be as high as 18,000.
Wow, okay.
That probably takes a while to get through.
Yeah, a few months for each probe to go through. Every 1,000 cycle, we do photographs from certain angles of the probe that are set in our protocol.
Do you ever do usability testing to make sure that it's functioning properly?
We note down all the observations. If there is anything significant, we will communicate with the probe manufacturer. And at the end of the cycles, we send the probe back to the manufacturer, and they run the fit and functional test there.
Oh, so it's the manufacturer that gives the final say of whether or not it's still in original condition, still working the way it's supposed to. What do you do in this room to help emulate like the real world use of a probe that's actually going to be handled in a facility.
Yeah. The main question is that a fake in there?
That's right.
Trophon step is one step of the reprocessing. The probes get wiped first, and then they get dry wiped, and then they will go through Trophon, and then after that, storage and handling will be involved. So we tested the probes like when, as you said, the user is not having a good day, so they push it hardly.
Yeah.
All these might affect the life of the probe.
So you're using real probes from real probe manufacturers, real Trophon machines, and essentially roughing them up a little bit along the way just to account for that real world handling.
Exactly.
I had an opportunity to sit down and talk with Reg at Siemens about device compatibility and how important that is. At what point in the process of manufacturing and designing a new probe do you actually get involved?
The beauty about our collaboration with probe manufacturers is that we are so involved early on that even when the manufacturers are designing the probe, they're thinking about compatibility, so that probes are designed with Trophon compatibility in mind.
I can show you some examples of what can happen to a cable through just wiping.
That's just from wiping?
Just from wiping.
How would you like that to be your job, to be
Right.
the probe wiper?
Yes.
And you can see on the cable difference in where it was wiped
Oh, yeah.
against where it wasn't.
Oh, wow.
And you can quite clearly see the chemistry and compatibility. So thank you so much, Baha. Now it's a good time for us to switch gears and go to the production lab, show you how probe compatibility is baked into the production of every single Trophon device that's released globally. We made it to our final stop, the production area, and we've got Anastasia to help us to run you through what happens here and how we actually build Trophon devices globally.
Yep, so welcome to where the magic happens. We pride ourselves on, one, being an Australian manufacturer, and two, our consistency with how we manufacture our devices. So we have in-process quality checks, so our sub-assemblies are tested on our sub-assembly line through jigs that make sure that they're functioning correctly. And then our main quality check is our end-of-line testing. So they go through a 5-hour test to make sure that our device is completely functional, so that it's ready to test a whole range of probes, and so that it's also safe for patient use.
Bobby, I can't help but think of the assembly area in sterile processing when I look at these workbenches.
Yeah, it does feel that way. As we've gone through the tour, every room I've reached for my head to feel, am I wearing my hat? And so the haircuts make me feel at home. So in my sterile processing department, we always had some music playing overhead, and people were dancing and cutting up, and part of me loved that for the culture, but it also kind of grinded against me from a quality perspective. Everybody is so focused in here, and it is super quiet. It seems like everybody takes the professionalism really seriously.
Yeah, they love their job. They love what they do. I think to know that we are actually helping patients and changing people's lives and preventing infection in the field keeps them going. Yeah. They know the value we have in our jobs.
We were just in the material lab, and what we saw there was essentially what someone in the hospital setting or in a clinic setting would see. But now that we're here in the production line area, these devices are incredibly complex.
From the front, yeah, it does look very simple. Yeah. But obviously, as you can see, it is quite complex inside, and it's a very clever device in the way that it's designed to pick up anything that's detected outside its specification.
From the user experience, it's really just one button on the screen and you initiate the cycle. But as you look behind the covers at the device itself, it's actually very sophisticated.
Thank you so much, Anastasia, for your time. And I think maybe as the last thing we can do here is actually have a quick tour through the production line so you can see how Trophon becomes from one single screw, one single part to the final device.
Sounds great.
Yeah.
Great. Thanks, Anastasia.
Thank you.
After the tour, Bobby had an opportunity to meet with the 3 Nanosonics regional presidents to discuss ultrasound probe processing from their perspectives around the globe.
All right, guys, we just wrapped up an awesome tour of the facility, and one of the themes that kept coming up was this conversation about probe compatibility. From a North American perspective, not something that I've spent a lot of time thinking about, although it feels like there's a Trophon device in every facility I end up in doing consulting. And so since I have you guys here, I want to hear what your perspective is on that probe compatibility in your respective regions.
Yeah, Bobby, in Europe, it's predominantly a manual wipe, high-level disinfection market right now. Some of them are made up of different chemistries and some of them have limited capabilities. For that reason, it's critically important that we have a probe compatibility program. I think we have over 1,300 probes on our probe compatibility program with 25 different probe companies. So it's crucial to our market and to the other regions that we have a program in place that's passed and approved by the probe manufacturer.
The INZ market is actually quite a success story, and that is because of the efficacy and the performance of our device. There are also other automated HLD solutions which might have limited compatibility data, and so in the company we focus on assessing probe compatibility, and that is with the sole purpose of ensuring the safety of patients, the users, and also the equipment.
What people don't realize is that there's over 30,000 devices globally. And the beautiful thing about it is it's the same device whether it's in Asia, whether it's in Australia, or whether it's in the United States. It performs the same exact way, has the same probe compatibility standards that we expect of a device that's out there in the market.
I'm sure from a staff training perspective that can be really useful, but also since we're talking about patient safety and efficacy and making sure that the device is safe for use for that next patient, I'm sure that gives a lot of peace of mind as well. So guys, thanks for sharing your perspectives. Appreciate your time.
Great having you here.
Yeah.
To really go beyond the tour, we found a lovely cafe to sit down and talk about what this all means for an industry we all care deeply about.
This is my favorite part of filming these Beyond the Tour episodes because we get to come together and talk about all of the things that Bobby and I had a chance to learn. Something that's overwhelmingly striking to me is just the vastness of what probe compatibility actually means. Being able to come here and learn from your team how much you invest in making sure that the people are safe, not only the patients, but the people handling the ultrasound probes. And also that the actual probes themselves function. It's been really incredible.
It's been a huge effort. We haven't started from day one with over 1,300 probes. No, we had to start somewhere.
Right, yeah.
We couldn't just snap our fingers and here we go, they're all compatible. I remember initially it was quite a reactive approach where, we'd get a call from a rep standing at an ultrasound room with a probe asking, hey, is this compatible? And that's where it would start. Would then reach out to the probe manufacturer and would say, hey, can we test this probe? And eventually would go through the testing that you've seen, all the cycles, temperature, etc., and get it ticked. Where now the program has really evolved into much more proactive. So part of my role, which is really exciting, is working with the probe manufacturers globally and making sure that every new probe that's coming out is Trophon compatible. And what's great about it now is that probe manufacturers realize that and they work in collaboration with us.
I actually think it's really important that we have that almost full coverage of probes that are available in the market. We basically want to give healthcare professionals the choice of using Trophon if they desire, particularly for semi-critical critical procedures that require HLD. So really our mission is to have a very broad compatibility program that allows healthcare professionals to choose the probes they want to use for that particular procedure and not be constrained by compatibility.
Right, you don't want them thinking about having to pick a less desirous product because it's the one that we can get reprocessed in our machine. That makes a lot of sense. Is there anything that you all do in just partnering with your customers to try to educate around what high-level disinfection is, that Spalding classification system, and trying to encourage them to use it in an appropriate way?
Yeah, we actually have clinical application specialists in the field. They'll go and consult with end users, with sterile processing staff and so on to help educate them on what is required. So you mentioned the Spalding classification. Right. So non-critical devices only contact intact skin. As soon as the skin's broken or you go to mucous membrane contact, it gets elevated to semi-critical and you have to do high-level disinfection. And so educating people on that is really important. A certain probe might actually be exposed to different tissues throughout the day. day. So there might be a non-critical procedure in the morning, a semi-critical procedure at lunch, and then a critical procedure contacting sterile tissue in the afternoon.
Exactly.
So
it's the same probe. That's all three. Yeah. And so that's what makes it so challenging with this particular issue. They think, okay, I just got some blood on this probe, so it needs to get high-level disinfected to take care of that probe. That's actually backwards thinking, right? It's too late to do the high-level disinfection after we put it on the patient with the open wound. It really needs to be thinking, how can we get this probe to the appropriate disinfection level before we put it on that open wound in that semi-critical situation?
Right, so you don't always have prior knowledge of what the procedure is going to be like before the patient gets there, right? Emergency department is a great example. So you've got a range of different options. You can high-level disinfect that probe on demand when it's required. Now that takes a little bit of time. You've got to think about whether that can fit into your workflow. In the emergency department, you might not have time. Right. So a better way to do that is to have high-level disinfected probes ahead of time, right, stored in appropriate storage, bags, etc., that are basically ready to go. So you can grab those probes and use them. Another thing that I've seen facilities do is actually just high-level disinfect everything all the time, because then you're basically ready for anything.
Right, and with as easy as a process that Trophon seems to have made it, it seems like the favorable solution to me. We're done with it. We just take the decision-making out of the process of trying to triage the Spalding classification, just put it in the machine after you're done with it, have it ready for the next patient. It makes a lot of sense.
Yeah, and a lot of the conversations that we have as a team at Beyond Clean revolve around this idea that the patient at the beginning of the day gets the best care versus the patient at the end of the day because of turnover, because of having to rush through steps, et cetera. And the same thing can apply here. Even running a disinfectant wipe down a probe, like everyone's going to squeeze at a different pressure. And they're going to, keep that contact on the surface for a different length of time. And there's no way to make that a safe option when what you're going for is consistent patient safety.
So all those kind of manual considerations are taken away with Trophon. It actually controls all of the critical process parameters. So in our case, it's the concentration of the chemistry, the dosage into the chamber, the temperature. The coverage is taken care of, obviously, with the mist. And then you have that chemical indicator that's a cycle verification. That's telling you the right amount of oxidative chemistry entered the chamber.
Sounds like peace of mind. Right. Yeah.
Confidence.
I've not seen any marketing materials out there of like, we can high-level disinfect most of the options, or we're the option that's going to damage your probes. So like, what would you say is like the key difference that you're proudest of to be able to make that compatibility claim and not just shout compatibility out into the open?
I think what's critical for us is the type of testing we do. So we don't just get a sample of a plastic and dip it in hydrogen peroxide and see if that seems okay or not. We do, testing with real probes, real cycles on real Trophon devices, replicating that worst case, testing the temperature, testing for lifetime of the probe compatibility. And I think that's the critical part that might be missing from some other reprocessing companies. And the other key which we spoke to is that probe manufacturer approval. You really need both parties to jointly approve to confirm compatibility.
Yeah. It's impressive the work that you've put in to get over 1,300 different probes.
Kept us busy.
From a motivation standpoint, like I can't see any reason why you wouldn't be all in on making sure it's absolutely safe for devices, right?
Exactly.
But there are still, I'm sure, customers out in the field who are working with these probes. They start to see cosmetic damages or tears, and they're wondering where are these coming from. And it probably doesn't do a whole lot of good from your all's perspective just to show them a compatibility matrix and say, nah, it wasn't us. So how do you reach out to customers and help them work through those kinds of damages as they're encountering them?
What we like to do is to go in and consult with the healthcare professionals and understand, well, what are you actually doing with your probes day to day? Often we find that they're being used with an incompatible product. So they're being used with another cleaning or disinfection product that's actually not listed in the IFU for the probe. That's really common. And look, in the defense of the end users, that's really complicated because you've got all these different products that you might be using, and every IFU for every probe is potentially different. And so you've got to do this big matrix crosswalk of all these different systems, and it's very challenging. So it's handling, it's using incompatible products. Those are really probably the main causes of probe damage that we see in the field.
And as a matter of fact, when I was reviewing our post-market surveillance data, because it's a really exciting thing to look at, every single allegation that we've investigated, the root cause was never the Trophon device.
Okay, that was going to be my next question. Yeah.
I think people watching this might think, of course, they're the manufacturer. They're not going to find themselves at fault, right? That's easy for them to say, but like I know, such a fair concern. I think something else to really consider is the big probe manufacturers that we're working with. They have a vested interest as well. They don't want to be putting something in their IFUs that they're not completely confident in. They don't want to put something out that could be damaging their probes that are, high capital pieces of investment for these healthcare practitioners. So for them working with us and putting the trust in us I think that speaks volumes.
I think if you just brought every customer with a complaint to see beautiful Sydney, come see the facility, I think that would deal with
one
it.
way to do it.
That's right.
All the months worth of work that you're doing to make sure that my probes are compatible with your machine. It just makes me feel like I can be confident. Press a button and I get to know that I'm gonna have a safe probe for the patients that I'm serving.
Exactly, and that's really, again, coming back to our mission of being patient safe, but also make it easy for the users. They don't have to worry, is the probe safe? Are they doing it correctly? It's an automated enclosed system. It's signed off by the probe manufacturers and by us. So the customers and the patients can have that peace of mind.
All right, you guys, thank you so much for having us here for this tour. I know that Linz and I both came away from the tour feeling inspired, I guess is the word, which is an odd word to use. And it's because what Beyond Clean has always been about is patient safety, reprocessing instruments the right way every time, every patient, every instrument, every time. And that story has been something that I've heard in every room that we went through on the tour, with every expert that we talked to, that we're going to do the right thing for patients. We're going to do the right thing to make sure that these probes work to the best degree that they can, optimally for those patients. And yeah, I'm so appreciative that you brought us on this tour. We joked earlier about how great it could be if we could bring all of the customers of Trophon to beautiful Sydney and see the facility. And I know that's not practical, but hopefully in this Beyond the Tour episode, we're able to share some of that beautiful story with the audience. So thank you so much for having us.
Oh, really? Thank you.
Yeah, for sure.
Thanks again.
Yeah, absolutely. Thanks, Lloyd.
All right, we are so excited that everyone is sticking around for the Q&A portion of this release. Just got a chance to watch the Beyond the Tour episode with Nanosonics, and joining me for the Q&A portion of this event is Matthew Wellicke, a strategic partnership manager at Nanosonics, and John Burdak, currently the Chief Medical Affairs and Scientific Officer at Nanosonics. We are so excited, Matt and John, that you're joining us for this Q&A. I know there are some burning questions in our audience tonight and likely around the industry, so we're really excited to tackle some of those. Thanks for joining us.
Thanks for having us.
Great to see you again, Lindsay.
Yeah, great to see you. I wish we were doing this live in Australia, but such is life. I'm here in Minnesota, Bobby's in Kentucky, and you guys are in beautiful Australia. So the beauty of the internet allows us to all be in the same place at the same time. So we're very excited about this. I'm going to get this show on the road. I know that there are a lot of questions coming in. And one of the questions that I want to start with is, what are the advantages of automated disinfection over manual methods? I know the Beyond the Tour episode spoke a lot to the benefits of automated disinfection, but I just want to really recap and from your perspective, talk about the advantages of automated versus manual methods.
Sure, I can take that. I guess intrinsic into any manual process is the human factor element. So you're relying on a person who needs to be trained, they need to have their competency assessed, that needs to be maintained over time. And that person has to carry out a set of instructions. And obviously, when you go to an automated method, a machine is taking over most of those steps or some of those steps. And so what the machine's able to do is make measurements. And, we have a concept called critical parameters. Essentially, those critical parameters need to be met in a reprocessing cycle. And so really, in the case of something like Trophon, it's measuring things like temperature, cycle time, the dosage of the disinfectant, and there are obviously controls over concentration as well. So all of that is taken care of by the machine, and the records are then generated and kept in the device as well. Whereas with a manual method, you're having to do that. A person is having to, dip a test strip and, write something down in a logbook and start a timer and make sure they're following all those steps in the correct order.
Great. Thank you for speaking to that. Another question that came through, plain and simple, can Trophon heat cause probe damage? I know probe damage is a very hot topic. I spoke with Reg at the beginning of the Beyond the Tour episode from Siemens about this idea of probe compatibility and probe damage, and I know we spoke to it throughout the episode as well. But, heat is obviously something that we pay a lot of attention to in the sterile processing space, because a lot of items we know are not heat compatible. So point blank, can the Trophon heat actually damage the probes?
So thanks for the question, Linz, and I'm happy to jump in here. As you've seen in the episode, we do a lot of testing to do with temperature. Ultrasound probes are heat sensitive, and overheating them can potentially damage probes that they are sensitive to temperature, and that's why with Trophon compatibility program, we very much focus on testing temperature. You've seen, adding the sensors, temperature sensors onto the probe, testing maximum temperature of the probe every time a probe's tested for compatibility, and those results are compared to probe manufacturer specifications, essentially to make sure that the probe never reaches the temperature limits of reprocessing. So short answer is no, we test for that, and probes are only approved if they meet the specification from the probe manufacturer, and hence we can always make sure the temperature stays below those limits and the probes are safe to be reprocessed in Trophon if they are approved as compatible.
Yeah, that compatibility portion of the tour that we did, or I guess all of it touched on compatibility, but looking at all the cycles that were run, was one of my favorite parts of it. Matt, another question for you, related not so much around the compatibility piece of it, but just the general processing cycle of Trophon. We compared Trophon to some of the other high-level disinfection methods out there. I think we talked about wipes and UV disinfection. There were some questions that came through about some of the other differences aside from compatibility of probes that you might experience between those options for high-level disinfection. Maybe like the total cost of ownership of having to have the equipment and purchasing the consumables, and PM requirements that might come along down the road, environmental considerations for disposal. So can you talk through maybe some of those differences that you think distinguish Trophon from other high-level disinfection methods aside from the compatibility program?
Yeah, most definitely. So to touch on the first part on cost of ownership, obviously you've got manual disinfection, which will be a consumable cost each cycle. And you've got the other automated systems, which may not have consumables, but you have quite a large capital cost at the beginning. Where with Trophon, it's a hybrid. It's a mix of both. So you do have a small capital cost of the device to start off with, and then actually the cost is broken down through each cycle, where we use disinfectant, hydrogen peroxide in each cycle. One disinfectant probably lasts about 35-40 cycles, so you use it through many cycles. We find that customers actually really like that solution in terms of cost breakdown, and it's quite competitive because you don't pay a high premium per each cycle as you might have to with some of the manual methods, And at the same time, you don't have to spend a lot of capital, which sometimes might be hard to get approved at the very beginning. So it's a good breakdown throughout the usage of the device, where you pay small capital, cycle cost per consumables as you go, and the price over the lifetime of the device, if you say, for 5-7 years, etc. If you compare that to manual methods and other automated methods, it's very much competitive, and again, that's why a lot of our customers select this solution as most competitive in terms of pricing. Other things, servicing, it's quite minimal. You basically, because the machine's plug and play, you just have to service it annually. It's quite a straightforward check. It can be done by certified biomeds at the hospital, or it can be done by Nanosonics service staff. So it's quite straightforward. And then we've touched on already, one of the key differentiation is the automation, which John spoke to. So the potential risk of using a manual method, which might be prone to some user risk as well, versus automation, which is simple. Put the probe in, you press the button, and it's done. So that really is one of the key differentiations to it.
Yeah, I appreciate you diving into that. And that's actually a really good segue into another one of our questions that came through about that automated method versus a manual process. Most automated processes depend on something manual in order for the automated part to succeed. Like in sterile processing, if I take soiled surgical instruments and just throw them straight into the washer disinfector, they're going to come out soiled because we didn't do the manual part ahead of time. Can you talk through what are the manual steps required for ultrasound probes prior to the automated process in a Trophon? Is that the same every time? Does it differ based on your probe manufacturer? What does that look like?
Yeah, it's there are quite a few variables. It depends on the nature of the procedure that the probe has been used in. It depends on the probe design, any accessories that might be attached, and then it does actually come back to the probe manufacturer's instructions for use for cleaning. And there's quite a variety of options in terms of how to pre-treat and clean probes prior to HLD. So some probes can have accessories attached to them. And obviously probes are used with gel. So usually at the point of use, you're going to remove any accessories, so that they might be things like biopsy guides, and you're going to remove gross gel. At that point, the probe is not clean, but that's sort of the point of use pre-treatment. From there, depending on the workflow, the probe can be transported to a separate area for further reprocessing. That can be anything from washing in a sink, soaking in an enzymatic detergent, or it can actually also be done at the point of use with appropriate wipes. So many of the probe IFUs will allow you to clean the probe with wipes. They can be combination cleaning disinfecting wipes or dedicated cleaning wipes. And so there's such a variety of options, and it really depends on the IFU. So you've got to go back to the IFU, both the IFU of the probe, but then also the IFU of the cleaning product. And really you've got to integrate those two things to come up with your SOP and workflow. But yeah, it can be point of use, it can be in a different setting, and there's a variety of products that can be used, obviously.
That's good. I figured that would be your answer, and that is the token IFU answer on every Beyond Clean interview we do. Somebody has to say, go back and read the IFUs, right? So I appreciate that. But it is a good point to bring up that that even automated solutions aren't totally plug and play. Like you can't erase all of your training and education woes around manual processes by implementing a manual one, because you're still going to have to do that risk assessment or that review of IFUs, do the education around that piece, and make sure that part is solid so that you're getting good results out of your disinfection equipment. Have I summarized that well?
Yeah, that's right, Bobby. I guess what we automate is the HLD process. We don't automate the cleaning process. You've got to think of reprocessing as being those distinct steps. And the reason you have to follow the IFU is because the manufacturer has to validate the cleaning process, right? So they've actually, they should have undertaken testing to demonstrate that cleaning process can actually lead to a probe being cleaned appropriately before getting into HLD. And so we accept the probe at the end of cleaning, and that is something that is clean and dry, and then it goes into the Trophon process. We do have some human factors at each end, but the middle part of that is automated. And so, yeah, that's really our area of expertise, and there's obviously up and downstream processes that interface with that.
I love talking about automation in a number of settings related to healthcare. and really having the conversation about what automation can do for increasing your trust and confidence in a process, and the opportunities that exist with any portion of the reprocessing process being automated, and how that can lend itself to just making sure that I know this one thing, this one stage will happen the exact same way every single time. And so it's really the other things that need more, more consideration, more detailed time and attention, because there are more risk factors involved. So
The other
appreciate you
neat
speaking to
thing,
that.
Linz, the other neat thing with automation is generally you don't have to do anything, right? So you put it in the machine, you press go, and you can go do something else. So while that cycle's running, you've got free time to go and work on other things. And obviously, if it's a manual process, depending on what the manual process is, if it requires you to physically be there, that's using up time and
Right.
and thinking.
Yeah, that makes sense. One thing that I'm curious about is kind of regardless of what process you use to actually clean and disinfect and high-level disinfect ultrasound probes, are there any specific pathogens that have really caused a problem for ultrasound probes and high-level disinfection, to your knowledge?
Yeah, I mean, obviously the resistance profile of microorganisms is fairly well understood, but there are some viruses, in particular human papillomavirus, which is kind of atypical in that it's very hard to disinfect. So it's an example of a non-enveloped virus, and we actually pioneered some pretty cutting-edge research quite a few years ago with Professor Craig Myers at Penn State. And he's a virologist, and basically to grow HPV in the lab is really difficult. You have to mimic the differentiation of skin tissue to be able to grow the virus in a dish. And so what people had done prior to that is they'd taken basically DNA and protein and mixed it together in a tube and then hoped that it formed something that looked like a virus, and these are called pseudovirions. And obviously, if you take that sort of fake virus that's just made up of the components and it's not really stuck together properly, it's actually quite easy to inactivate. You can inactivate that with alcohol. However, if you actually take a mature HPV virus that comes from actual cells, it is very, very difficult to disinfect. And so Professor Myers produced some data showing that glutaraldehyde and OPA were ineffective at disinfecting that virus. Since then, there's been some more research that shows that they might have some efficacy. So I think the jury is out exactly on the level of efficacy of those agents around human papillomavirus. But obviously the significance of this pathogen is that people that are undergoing endocavitary exams, so particularly transvaginal, transrectal, but even transesophageal exams, if they're exposed to human papillomavirus during that procedure, that can go on to cause a mucosal cancer. And so we actually tested Trophon against the two predominant cancer-causing HPV types, so HPV 16 and 18, many years ago, and demonstrated that Trophon was effective at inactivating that virus, which obviously has a real clinical implication, particularly in the way these endocavitary probes are used. That's probably a good example of a sort of atypical organism that's sort of maybe even harder to inactivate than a spore, right? So we think of spores as being the toughest. But some of these non-enveloped viruses can also be very hard to disinfect.
Right.
That's really interesting. And from an IP's perspective, just kind of from the practical matter, I think a lot of IPs wish that we could just terminally sterilize everything, and have devices that could handle that, right? But we're not there today. But one of the big advantages you get with that terminal sterilization, in addition to the extra log reduction that you get from sterilization, but also is the storage piece of it, being able to terminally sterilize it and set it on the shelf. That's something that I don't think we got into very much in the tour, but after HLD for these ultrasound probes, is there a recommended length of time that they can be held in storage before use on a patient, before we need to think about maybe re-disinfecting it before using it on an open wound or something like that?
Yeah, that is a great and complicated question. And unfortunately, there isn't a simple answer. It depends a lot on the context. So if the probe has undergone HLD, And with Trophon, it's a dry process. So at the end, there's very limited opportunity for recontamination. You're not immersing it then in water, which can obviously have microorganisms in it.
Yep.
If you take that probe and you put it into a clean cover, we have a clean cover product that you can use, and then you store it somewhere where it's not going to get moisture, etc. It can probably be stored for quite a long time, right? So that's one way of storing probes, but probes are often high-level disinfected and then just put straight back onto the console of the ultrasound machine. So they're just sitting there, open air. Certainly if you're using wet processes that have a rinsing step, there's a risk that that rinse water can be contaminated and they may not be fully dry before you store them. Another thing that people do is they store them in cabinets. And a lot of this thinking actually comes from endoscopes, right? There's so much focus on endoscope storage. Probes are quite different to scopes. I can get into that in a moment, but a lot of people store their probes in cabinets. Now, the problem with storing your probe in a cabinet is you've got to take it from the point where it was high-level disinfected. You have to handle it and transport it to the cabinet. Then it's got to be taken from the cabinet to the console. And all of that extra handling actually can introduce a lot of contamination. I mean, I think the cabinet is a reasonable place to store it, but it's just all that extra handling up and downstream can be an issue. So we would suggest if you want to use a cabinet, take it out of the Trophon device and put it straight into one of these clean covers. It's essentially a plastic bag with a custom designed tie that goes around the cable. So that's going to basically maintain that probe in a pretty clean state. You can then put it into the cabinet in the bag, and you can take it out in the bag. You can transport it around in the bag. That's going to protect the probe from recontamination. Coming back to the endoscope piece, endoscopes are long. They have small lumens. They're reprocessed via wet processes. They're very hard to clean. There are a whole bunch of factors that make them very high risk for storage. A lot of those things don't exist with probes. Probes are generally non-lumened. They have a hard, non-porous surface on the outside that can be dried quite well at the end of the reprocessing. But I guess here I am not really giving an answer, but you've got to factor in all of those different things when you're coming up with your policy. A conservative approach would be to take an endoscope hang time and say, well, probes have all these other attributes that are probably better than endoscopes. So we're going to use endoscope hang time. That's a decision we're going to make. That's one line of thought. But you might feel quite comfortable that, hey, this probe has been high-level disinfected. It's being stored dry. It's in a bag. We could have an extended storage time based on that. And you could do some microbiology validation in your specific setting, I guess, if you wanted to as well.
Yeah.
Are there specific standards that speak to probe hang time, probe storage time, or is it more a risk assessment situation?
Yeah, it's a risk assessment situation at the moment. There's some AMI TIR 99 has recently come out, which is a technical information report from AMI on probe reprocessing, and that has some of the things I talked about there are covered in that document in terms of inputs, but there isn't an official kind of hang time from any organization that I'm aware of around probes because of all those variables.
Sure.
So one of the questions that came in says, it seems the impression that I've gotten in my network of IPs is that Nanosonics is pushing HLD above everything else, that no other option should exist. Can you speak to the true or false nature of that impression, and speak to what it is that you're encouraging from your perspective, what you're encouraging of the industry for the highest level of patient safety?
I'm really glad to have the opportunity to address this, Lindsay, because I think it is something that people are talking about. I expect the question is in reference to percutaneous procedures. So there are, a little bit like the storage thing that I just spoke about, there's such a diversity of use of ultrasound. We have over 1,300 ultrasound probes on our compatibility list. So you can imagine they're all used for different types of procedures. And one common use of ultrasound probes is actually in percutaneous procedures to guide needle-based procedures like biopsies or line placements and so on. And so all of these procedures can be different, and they can even be different down to the individual patient, their anatomy, the clinician's technique. There are so many variables. So our position around this for many years
has always been that you should follow the Spalding classification. And that's going to split things into critical, semi-critical, and non-critical. So in the case where you do a procedure and there's no contact between the ultrasound probe and any broken skin, so it's not contacting the puncture site, and there are certainly many of these procedures where there is no contact, and in fact the probe is quite far from the needle, that's a non-critical procedure, right? So that probe would need to undergo low level or intermediate level disinfection before use. Whereas if the probe does contact the puncture site, and there's, again, all those variables taken into consideration, the probe does contact the puncture site, that's at the very least broken skin and potentially sterile tissue, because you have a needle that's basically going into somebody's sterile tissue. And we've seen over and over again on probes used for these procedures, needle gouge marks in the lens of the probe. So, often a user will cover it with a sheath. So there'll be the sheath, there'll be gel, then there'll be the probe. But of course, people actually doing these procedures sometimes make mistakes. That needle goes through the sheath and will actually gouge the window of the probe and then go into the patient. So it's really important that that probe is high-level disinfected at a minimum. And in some cases, in a surgical setting, you might even want to do sterilization. So I think what's complex about this is the degree of variability. So from an infection prevention perspective, it's really important that IPs go out and look at what's actually happening in the departments. And I think you've got to write a policy that allows for the end user to make the call on whether this is a critical, semi-critical, or non-critical procedure, because they need to select the right probe before the procedure. So they need to select a low level or intermediate level disinfectant probe before the procedure for a non-critical. They need to select a high level disinfectant probe for a semi-critical procedure prior to the procedure. Or, if it's critical, there's recommendations to do HLD and sterile sheath or a sterilized probe. I keep coming back to this before the procedure thing, because a lot of people think about this in terms of, oh, blood got on the probe, now I need to clean it and disinfect it to a higher degree than I otherwise would. The reality is these probes are used in different procedures, one after the other. So you might actually have a semi-critical procedure followed by a non-critical procedure. And so you go HLD before the semi-critical, and then you go back to your LLD after that. So you actually need to have different disinfection options depending on how your probes are used. And this is a lot of work and it's complicated. There's a lot of education required. There is a bit of discussion about it in AAMI TIR 99. There are some things to look out for, but I think this is an area that continues to evolve. There are some guidelines that declare all percutaneous procedures to be non-critical, and for anybody that's really familiar with this space, it just really doesn't make any sense. There are certainly very invasive procedures where there's very clear contact, but then there are other procedures where there isn't contact, and so they are non-critical, and so it's all about the nuance. And so yeah, the idea that Nanosonics thinks everything should be HLD is just false. We've never said that. I have heard that stated back to me several times, and I think that this is just sort of the rumor mill running. But our position has always been follow Spalding, and I think putting the decision into the clinician and IP's hands around how they want to structure their framework to do that. But clearly, that Spalding framework has served us very well for many years. It's actually amazing how well thought out it is, and we should continue using that going forward.
Thanks for clarifying that, John. As I think through that answer of all of the decisions that need to go into that process, have you seen anything that's particularly useful in crafting that policy so that IPs can help users make those decisions wisely? Are there any resources or policies that you've seen be effective? I mean, one option, you said it's not officially the Nanosonics position to just HLD everything. That certainly is one option, so that all your probes are always available for whatever procedure it is you're going to do. But assuming that's not what the facility is doing to date, what kind of help is there out there for IPs to write that policy well?
Yeah, so I mentioned TIR 99. That has a few points in it that you could go look at. We have a ultrasound IP toolkit that was put together several years ago by a group of quite well-known infection preventionists. That has some information in it as well. Can maybe get you the link to that after the show. But I guess implicit in your question is also how do you do this in practice, right? So HLD all is actually something that some facilities have decided to do, and I guess it's more costly, but the benefit of it is it takes the decision making out of it. You just every time you get a probe, it's high level disinfected. It probably comes down to your mix of procedures. Like if 90% of your procedures are semi-critical, that probably makes sense. If 1% of them are semi-critical, well, you're doing a lot of HLD when perhaps it's not so critical. However, what you can do, in something like an ED setting, you can have a probe that has undergone HLD that's sitting there ready to go. It's in a bag. And so, patient comes in, let's say it's a trauma patient, they want to do FAST, which is assessment of wounds and so on. So you can grab that probe, you're ready to go. Or you want to put a central line in, you can grab that probe, you're ready to go. And that gets rid of the wait time. We've got to do this procedure, probe's not HLD, we've got to do that now, and that can obviously interfere with workflow. So I think there are a few different ways to approach it, but it really depends very much on the department, what their requirements are, what types of procedures they're doing. And again, the technique of the staff, there is a no-touch technique where you don't touch the probe, but also the anatomy of the patient, the thing that you're trying to target, the anatomical structure, if that sits right under the probe, by necessity, you have to have the needle and the probe right on top of each other. But if they're far apart and you have the probe over here and you have the needle sort of over here, it's not so much of a problem. And so you got to look at all these different factors.
Yeah, thank you.
Do you have, is there anything specific that a Nanosonics, representative can do in terms of going into a facility, educating them on, really assessing what it is that they're working with in terms of caseload, in terms of types of procedures, educating IPs and other, clinical staff who may handle ultrasound probes in exam rooms, making sure everyone's on the same page, and then also accounting for turnover in the departments, and understanding that, that information may be tricky to pass along unless there are standard policies and procedures in place and one place to keep them. But how does Nanosonics support making sure that compliance remains?
Yeah, good question. So we have a clinical applications team. So essentially these staff are, they assist our sales team, but they're really focused on workflow and working with end users on SOPs, processes, implementation of Trophon, and they're not directly selling our product. So they're in there to help the clinical staff with their clinical work. So a person like that can come in and help give input into this process. Obviously, the facility's got to own their own SOP, but they can give some advice around different resources, and they can, look at workflows with an IP or with departmental staff and discuss different options for, how you might do your high-level disinfection, but also those up and downstream processes that we were talking about before, whether that's cleaning or storage. Yeah, I would encourage people to reach out to their Nanosonics rep if they want that assistance. Then, of course, you've got all the standards and guidelines and documents that we've been talking about already to refer back to.
And just to add on to that, we also have quite a wide resources available online. So we've got a Nanosonics Academy where all the customers can watch training videos, also see resources about when to HLD, spotting, etc. And a customer center where they will be able to access some of our clinical bulletins and IFUs training material as well that can supplement, not just the Trophon training, but more the infection control policies that they might want to build. So there's definitely, first option is the clinical specialist to come on site, help them, but due to the time constraints, maybe they need something immediate straight away. The Nanosonics Customer Center and Nanosonics Academy are definitely great resources as well.
Do your clinical applications team members also help folks who may have questions about how to monitor and control the environment that the Trophons are in, look at their spaces and see what makes the most sense from a workflow perspective, if you only have a hand washing sink, what do you do in that case? Like, are those some of the specific things that team can come in and really assess and make recommendations around?
Absolutely. So you touched on a few things there. So, often space is at a premium, and where do you put your Trophon? So, we mentioned that point of care, that point of use treatment, and then point of care kind of workflow. So you can have the Trophon next to the ultrasound machine in the procedure room, and there's some suggestions we can give you around how to do that appropriately. Some people have it near point of care, so it might be serving multiple procedure rooms. That obviously means you've got to transport the probe to that site to be reprocessed. And again, there's a whole workflow around that. And then, of course, you have the SPD piece where you've got Trophons in SPD, and then you've got probes coming back, through your normal instrument transport processes coming into the department. So there's a whole variety of things to consider there. And then there's that up and downstream processes element of how we're going to clean it. So if you've got a hand washing sink only in the procedure room, there's no instrument sink, of course there can't be dirty instrument cleaning in a procedure room in a sink. That would cause a whole bunch of issues. But you can potentially look at wipes as a cleaning option. Like if your probe IFU supports the use of wipes for cleaning that probe, you can check that in the IFU, and you may be able to use a wipe-based method for cleaning rather than a sink-based method. And so that is actually pretty common, I would say, for probes. So there are options around these things, and certainly there are a lot of variables again in the workflow, and having someone help you map out what's most efficient and what the options are, I think could be really helpful.
And Trophon device is quite mobile as well, so it can fit into those different scenarios, those different workflows. Obviously, it's a plug-and-play device, so you can have it on the bench. There's wall mount options, there's a cart as well that can be wheeled around different rooms. So it really supports that point of care option, but also near care or in the central sterilizing department. So it's really up to the customer needs, and it should be able to fit all those different scenarios.
Great. This final question that came through, I think, sort of harkens back to the initial conversation we had at the beginning of this Q&A about heat damage. But this question is, if someone were to troubleshoot where their probe damage is coming from, and they are busy people, they're busy IPs, they're running around, they're trying to figure out where this damage is coming from, where do you suggest that they start in trying to figure out, instead of just guessing where probe damage that they're experiencing may be coming from, where do you suggest that they might start to uncover the root cause?
I think the key is to always try to work with the probe manufacturer, and if there's a biomedical department that's also responsible for fixing probes, it's important to get in touch with them so they can review the whole workflow. And I think the key will be to look at all the potential touch points where that damage may have been caused. Obviously, it depends on the type of damage that might narrow down which area you're looking at, but we really have to keep in mind there's so many touch points to usage of the probe. So reprocessing, disinfection is one small part of it. You've got the pre-cleaning, where you might have to check the compatibility of different wipes. You've got the handling method just during the usage of the probe, the storage, maybe the transportation, if it gets transported to sterilizing department, what happens there. So really important to basically have a checklist of all those points of, okay, what did we do during usage, transport, disinfection, storage, etc. So you look through the lifetime day use of the probe and look at the potential causes that may be a contributing factor or maybe the root cause, and really check all of those, make sure you're using compatible chemistries, making sure your disinfection is also compatible and approved by probe manufacturer. And because at the end of the day it's a probe damage, that's why it's important to speak to the manufacturer of your equipment of the probe to assist with looking at potential causes. If there's any questions about Trophon usage and if there's anything that needs to be checked with the Trophon device itself, obviously our team can also be involved, and that can include the clinical specialist, or it can be our own technical engineers as well.
Great. Wonderful. And I do have a bonus question. This didn't come in from the audience. This is just something I'm curious about. If you could have someone take away one thing about the Trophon device, about ultrasound probe processing from either the Beyond the Tour episode or this Q&A section, what do you wish everyone understood about this topic? Sorry to put you on the spot here, but
yeah.
welcome to a Q&A, I guess.
This is great. I think the thing that jumps out straight to me is what we've seen in the episode, and obviously about compatibility, because that's where my experience lies. And it's really about a probe compatibility program, not just checking the equipment and us doing our own evaluation, but really making sure that the probes are safe for the patient, safe for the users, and safe for the equipment. So we will be looking at, as you've seen, the efficacy testing, the residual testing, and the material compatibility. And it's really important to look at all those factors. So I think that's the most thing that I'm proud of and really involved in, and really glad that we do such a rigorous job at assessing compatibility. And then obviously having the probe manufacturer approval. So that's the key standout for me in terms of Trophon and Trophon processors.
John, what about you?
Well, what Matt said was great, and I very much agree. I think more on the medical affairs front, this probe processing is challenging. We talked about all the different bits of information that you might need to consider in deciding how to go about it. I guess our mission is really to make HLD both as safe and effective as possible, but also as easy as possible for the end user. So, we do provide a lot of support to our customers in terms of how to implement probe reprocessing, how to think about it, how to have the best and optimized workflows. But we have a real commitment to patient safety and efficacy. There are many ways that this process can go wrong and that patients can be put at risk. Whether that's human factors, errors, misapplication of certain disinfection approaches and so on, incompatibility between cleaning and disinfection methods, storage. I mean, we talked about so many of them. So this is actually a really tough topic for sterile processing staff, for IPs, and of course for the ultrasound end users, who are usually sonographers or physicians, physician assistants, nurses, and so on. And, instrument reprocessing isn't generally a core focus of their world. They want to pick the probe up and use it, and they want it to be safe. And so there's actually a whole range of stakeholders that have to come together to make all of that happen. I really hope that Nanosonics is having a positive contribution to that professional interaction between those groups and trying to bring a bit of clarity to what is a very complicated subject.
John, I think that's a great word to close on. Thanks for pitching that bonus question in there at the end, Linz. I think that was a good way to wrap it. Guys, there are a lot more questions we could spend time talking through, but I think we're already over what we had planned for this Q&A. So Matt, John, thank you for letting us put you on the spot here and pitch you some questions from the field. I appreciate it, you guys.
No worries. Thanks for having us.
Yeah, absolutely. And one more thank you to our listeners. Thanks for tuning in, not only to the Beyond the Tour episode, but also this Q&A session, and just trying to dive deeper into how technology can help us keep our patients safe. So until we talk to you next time, we'll encourage you, as we always do here at Beyond Clean, keep fighting dirty.
Thanks, everybody.
Thank you.
Thanks.